6 minutes from now, you'll know what folate is, what it does, how to tell if you're deficient, and the 2 scenarios where you must supplement. And as a bonus, I'm giving you my B12, folate, and prenatal supplement summary so you don't forget any of this content. Hey, I'm Dr. Tom Scheck-Snyder, and I want to help you understand your labs and optimize your health. Because when your health is optimized, you can do anything. Let's go. What is folate? Also known as vitamin B9, folate is a class of water-soluble B vitamins. It's made by microorganisms in plants, so it is present in high concentrations in plant foods, especially greens. An easy way to remember this is that the name folate is derived from the Latin word for foliage. Folate equals foliage. Animals that eat plants also store folate in their bodies, so smaller amounts are present in milk, eggs, and meat. On top of that, since 1998, the US government has mandated fortification of grains, including cereals, flour, rice, and corn with folic acid. So it's literally in all foods. I don't know if you noticed, but I just did a name switcheroo there. I said folic acid instead of folate. This brings up an important point, so let's be chemistry nerds for a second. The active forms of folate are the fully reduced tetrahydrofolates. The main form of folate found in most supplements and fortified foods is folic acid, which is the oxidized and inactive form. Our bodies must convert inactive oxidized folic acid to active reduced tetrahydrofolate in order for it to do its job. This is where you'll encounter the seemingly profane acronym MTHFR. This stands for methylene tetrahydrofolate reductase, which is an enzyme that helps in that conversion process. There's a mutation that decreases the activity of the MTHFR enzyme, and it affects between 1 to 25% of people depending on ethnicity. Those people will have low folate, high homocysteine levels, and other B vitamin deficiencies, and they should supplement with tetrahydrofolate, not folic acid. MTHFR wasn't the main topic of this episode, but I didn't want to gloss over it since it's really important for some people. What does folate do? Folate is a helper in methylation reactions. Methyl or single carbon groups are required throughout the body for a variety of processes. The 2 most important methylation reactions folate helps with are DNA synthesis and the conversion of the amino acid homocysteine to methionine. When DNA synthesis stops because of folate deficiency, megaloblastic anemia is the result. And if folate isn't there to help convert homocysteine to methionine, homocysteine levels increase in the blood. High homocysteine levels are associated with increased risk of cardiovascular disease, strokes, and dementia. Don't forget that folate and vitamin B12 are required to convert homocysteine to methionine, so if your only signal is elevated homocysteine, you must check B12 and methylmalonic acid levels as well as folate. What are the symptoms of folate deficiency? Predominantly anemia symptoms, which are fatigue, shortness of breath, decreased exercise tolerance, and lightheadedness, among others. How do you diagnose folate deficiency? If you have anemia symptoms, get a complete blood count and a blood smear to check for megaloblastic anemia. Also, get folate, B12, homocysteine, and methylmalonic acid levels. Normal folate levels are above 4 nanograms per milliliter. Low levels are below 2 nanograms per milliliter. Borderline levels are between 2 and 4. If your level is low, start raising it right away. If your levels are borderline, then is your homocysteine high? If yes, also start supplementing and consider other B vitamin deficiencies like B6 and B12. You can raise your folate levels by eating healthy foods and taking a supplement. And I've linked 3 good supplements in the description and on the supplements guide. I've got one for prenatal prophylaxis, one for folate deficiency, and one that's good for both. Before we go on, pretend hitting the red subscribe button will make you smarter and optimize your health. Seriously though, I hope it does. So go ahead and hit it now. Let's talk about the 2 groups of people that must take folate supplements. First is women planning to become pregnant and those who are pregnant. I call this group prophylaxis because these women are usually not absolutely folate deficient. They're just entering a time in life where they're at risk of becoming deficient because of increased need. We're not relying on folate levels here. We're simply supplementing to decrease the risk of neural tube defects, which are malformations of the baby's brain and spinal cord like spina bifida. Those happen within the first few weeks of pregnancy, often before women know they're pregnant, so it's important to get ahead of them. Pregnant women are supposed to get 600 micrograms of dietary folate equivalents daily. 600 micrograms refers to the total combined folate intake from diet and supplements. That amount is tough to obtain from food alone, so the American College of Obstetrics and Gynecology recommends a supplement of at least 400 micrograms daily from 1 month prior to conception to 12 weeks gestation. On the other hand, the tolerable upper limit dose of folate supplementation is 1,000 micrograms daily. So for those reasons, the doses you'll see in most prenatal vitamins and individual folic acid supplements is between 400 to 1,000 micrograms. And dietary folate equivalence is a correction that adjusts for the increased absorption of folic acid supplements compared to the folate bound up in foods. The correction is this: 0.6 micrograms of folic acid from a supplement is the same as 1 microgram of folate from food. Supplements are more potent. You absorb the supplement more effectively, especially if taken on an empty stomach. The second group who must supplement are those with lab-proven folate deficiency. This group I call treatment. If you have a low folate level, the dose is between 1 to 5 milligrams daily for at least a few months, really for as long as there is a risk of deficiency. You're especially at risk of folate deficiency if you drink alcohol heavily, as alcohol decreases folate absorption and can be associated with a very poor diet. Also, if you take the anti-seizure medication valproic acid or have severe inflammatory bowel disease, you're at risk. Of course, follow the folate levels and be vigilant for other vitamin and mineral deficiencies. So what should you do next? If you have concerns about B12 deficiency, especially if you're vegan, watch my video on everything B12. If you have heavy menstrual cycles or iron deficiency anemia, watch my video on hemoglobin, where I give insight into diagnosis, recommendations about iron supplements and foods, and strategies to minimize side effects. Here's to understanding your labs and optimizing your health.